Finding the perfect Medicare for you requires careful consideration of your healthcare needs and budget. Choosing the wrong Medicare plan is not only a hassle, but could impact your options for healthcare and your financial stability. I've seen it so many times. People have chosen the wrong plan and they end up not having access to the care that they need, not being able to see the providers that they love and have been using, and that it costs them more money than it needs to. Medicare is not a one-size-fits-all, and if you don't fully understand your options, how can you make the best choice for your personal healthcare needs? If you don't know me yet, I'm Jane Petrie. I've been a Medicare advisor for over 15 years, and I help hundreds of clients navigate this complex program and lead them to be empowered to make the right decision for their Medicare coverage. My mission with these videos is to provide people education with unbiased, truthful information, which helps guide them to making the right decision for their lifetime of healthcare needs. In this video, I'm going to provide a step-by-step guide on how to find the right Medicare plan for you. You will learn the different types of plans that are available, critical points to consider when choosing your plan, and insider tips that will save you from making mistakes. By the end of this video, you will have the knowledge to be confident in choosing the right plan for your needs. So let's get right into it. Step number 1, assess your healthcare needs. Consider your past medical usage. How often did you go to a doctor? Did you have surgeries or regular treatments? Evaluate your current medications. List your prescriptions, since different Part D plans cover different medications. And lastly, anticipate future healthcare needs. Consider potential changes in your health. Statistically, the need for medical services increases with age. Step 2, understanding the different parts of Medicare. So original Medicare has Part A. That's your hospital insurance. It includes inpatient hospital care, skilled nursing or rehab benefits, and hospice care, but it covers the room and board only. Then there's Part B, your major medical insurance. This covers provider services, including specialists. It covers outpatient surgeries, labs, x-rays, CAT scans, durable medical equipment, physical therapy, etc. It's the busy side of original Medicare. Then there's Part D, again part of original Medicare, and this is your prescription drug coverage. This is added on to original Medicare as a standalone plan. With original Medicare, Part A, B, and D, you have an option to add on a Medigap plan, also called a Medicare supplement. This helps pay most of the cost that original Medicare doesn't cover, such as copays, coinsurance, and deductibles. And lastly, the standalone plan called Medicare Advantage, or Part C. This is an alternative to original Medicare. It actually replaces original Medicare's Part A, B, and D, managed by private insurance companies. Step number 3, assess your budget. These are the things that you need to look at. The monthly premium. Determine how much you can afford or budget to pay monthly. What are the deductibles that you may be responsible for? You must consider how much you might pay. The amounts that you must pay before the plan starts to pay for benefits is a deductible. Coinsurance is usually a percentage. For example, with original Medicare, it's 20%. Copay is a set amount that you will pay as your share of the cost for the care. A copay is typically a fixed amount, like $30 for a specialist visit. And an out-of-pocket maximum, an annual maximum amount you will pay before the plan pays 100%. The out-of-pocket maximum only is applicable to Medicare Advantage plans, as Medicare has no annual maximum out-of-pocket. Step 4, compare your plan options. One way to do this is to use the Medicare Plan Finder at Medicare.gov. On this website, you can compare plans based on your geographic area. When comparing plans, it's important that you compare not only the cost, but what that plan is going to cover. Cheaper plans might seem appealing, but they might not offer the best value if they cover less. Check if your doctors and hospitals are in the network. This only applies to Medicare Advantage plans, as original Medicare has no networks. With original Medicare, you can go anywhere in the U.S. or its territories. Step number 5, be informed. Read reviews and ratings of companies that are going to provide Medicare Advantage plans or the Medigap plans. Medicare Advantage plans are rated by Medicare on a 5-star system. Use this to gauge the plan's quality. Part D plans are rated on a 4-star system by Medicare. When you're looking at Part D plans, Medicare Advantage plans, and Medicare supplements, it's important to look at the overall company's rating by AM Best, S&P, Better Business Bureau, etc. It's important to read user reviews and complaints to understand potential issues and satisfaction levels with different companies. Step 6, understand your enrollment periods. The most common enrollment period is called the initial enrollment period. This typically is for people turning 65, and it starts 3 months before your birth month, and it ends 3 months after your birth month. Next is the special enrollment period. If you didn't enroll in Medicare during your initial enrollment period because you were still working or deferred Medicare, you might qualify for the special enrollment period. This is a period when you can enroll in or change your plan under certain circumstances. For example, leaving credible coverage, retiring, moving out of state. Then there's the general enrollment period. And this period is if you've missed your initial enrollment period or if it wasn't applicable, if the special enrollment period didn't apply to you, then you'd have to wait till the general enrollment period. This is every year, January 1st through March 31st. If one of the other enrollment periods weren't applicable, you would apply during the general enrollment period. And lastly, there's one other enrollment period, and it's annual. It's called the annual open enrollment period. This is the period that you can change your plan each year. You can change from a Medicare Advantage plan back to original Medicare. You can change your Part D drug plan. And the period every year is the same. It's October 15th through December 7th. Keep in mind that sometimes switching plans will require underwriting, and you must be in good health. Lastly, point 7, seek professional help and stay informed. This is so important. Consult with a Medicare advisor, a Medicare expert. They will explain the nuances between the different plans of Medicare and suggest the best option for you based on your healthcare needs and financial situation. Stay current with changes in Medicare and the Medicare policies and coverage guidelines. They may affect your decision during the next open enrollment period. And lastly, review Medicare's annual publication, Medicare and You. This offers updates and comprehensive information regarding the Medicare program. So those are my top 7 most important tips to lead you to having the best Medicare plan. I help hundreds of clients every year, and I go step by step to assure that they're properly informed and are going to make the best decision for their Medicare coverage. If you're interested in scheduling a free consultation with me, please contact me at my email or through my website. Thank you for watching, and I hope you found this helpful. And I hope to hear from you soon if you'd like personalized help with your Medicare decision.